In this video, we will share with you valuable, life-changing information about a common sleep-breathing disorder called obstructive sleep apnea. You are viewing this video to gain a better understanding of what obstructive sleep apnea is, or because your doctor has requested that you view it. We are sure that you will find this presentation informative and helpful. First, let us look at what we call normal airway breathing. The reason we say this is because this is the normal position of your airway when you sleep. Notice in this picture that when you sleep, that air enters through your nose and passes the flexible structures in the back of your throat. Air passes over the soft palate, the uvula, and the tongue. While you sleep, your throat muscles relax, but the airway stays open so you breathe normally. Here we see narrow airway breathing, which causes a common sound called snoring. You may have been told that you snore when you sleep. The sound of snoring is caused by the narrowing of the airway, which can cause air to vibrate the pharyngeal soft tissues, the epiglottis, and other tissue. The airway is too small to allow for smooth, unrestricted airflow. So what's the big deal? Everyone snores. This is what you may be thinking or have been told. Not everyone snores, but it is estimated that over 80% of Americans snore. Most cases are a result of a sleep-breathing disorder. The longer a person snores each night, the greater the problem could be. This problem is very common, and it is called obstructive sleep apnea. What is obstructive sleep apnea? Obstructive sleep apnea is a common disorder in which an individual has one or more pauses in breathing or shallow breaths during sleep. Breathing pauses can last from a few seconds to minutes and may occur 30 times or more an hour. Lack of oxygen forces the body to awaken momentarily to resume breathing. Normal breathing then starts again, and sometimes with a loud snort or choking sound. This is a continual cycle during sleep. Obstructive sleep apnea is often a chronic, ongoing condition that disrupts a person's sleep cycle with long-lasting negative effects on their overall health. In this picture, you can see an example of closed airway breathing, which results in a person having obstructive sleep apnea. Notice how the jaw has fallen downward along with the tongue tissue on the airway and collapsing it. In this picture, you can see that the air cannot come in or out of the airway and the lungs. So, obstructive sleep apnea is a situation in which the entire upper or lower airway is blocked, causing airflow to stop. In this dramatization, you can really see how serious this can be for a person with obstructive sleep apnea. The airway can close completely off and be collapsed for a person that sleeps on their back or even on their side at night. Let's look at some facts about obstructive sleep apnea and how serious of a medical disorder this can be. There are a lot of different health issues that can shorten your life and even cause earlier death. If you're diagnosed with obstructive sleep apnea, it can take 12 to 15 years off your life right now. It can also increase your risk of early death by 46%. These are some serious numbers to consider when it comes to the quality of your life and the length of your life. On the left of this diagram, we see a list of common symptoms related with obstructive sleep apnea. If you are presently experiencing any of these symptoms, then they are indicators that you are at high risk for obstructive sleep apnea and that you should be tested to make sure that you are not at risk. Some of the more prevalent symptoms and indicators are dry mouth or a sore throat when you wake up at night or in the morning. Other strong indicators are if you've been told that you snore when you sleep or gasp for air or even stop breathing while you are asleep. You may have been experiencing daytime sleepiness and tiredness, along with being forgetful and feeling like you're in a fog or depressed feeling. Take time to look at these and other symptoms and make note of any that you may be experiencing. On the right side of this diagram, we see a list of common health conditions related to obstructive sleep apnea. As you look at these health conditions, notice that many of them are very life-threatening. One of the most serious health condition categories are the ones related to the heart. If you presently have high blood pressure or hypertension, you're experiencing one of the most common health symptoms related to obstructive sleep apnea. If you have obstructive sleep apnea, you have a 76% risk of heart failure and a 63% risk of stroke. It can also put you at a 73% risk for Alzheimer's disease. As you continue to look at this list of health conditions, you can see how obstructive sleep apnea increases the risk of early death and causes people to die of preventable diseases. It is presently estimated that over 800,000 people in the United States have undiagnosed and untreated obstructive sleep apnea, and these numbers are increasing yearly. Now that we have a better understanding of what obstructive sleep apnea is and how serious of a health threat it is, let us look at different therapy options that are available. The two therapies that we look at in this presentation are CPAP and oral appliance. There are some elective surgery therapy options, but a few have been proven to have effective results. The common therapy for obstructive sleep apnea is CPAP. CPAP is an acronym that stands for Continuous Positive Air Pressure. CPAP is a machine that provides continual airflow to keep a person's airway open and requires that patient to wear a nasal or facial mask while they sleep. This therapy has been the only option for therapy for many years, but patients are frequently non-compliant with CPAP therapy. CPAP therapy is an effective therapy for obstructive sleep apnea, but patients normally encounter many therapy compliance issues. Patients find that the amount of pressure that the machine produces to be too strong, and it makes it difficult for them to breathe. Many find the device to be very limiting to the position that they might normally sleep in. For CPAP to be effective, you must lay on your back when you sleep. If you turn on your side while sleeping, there is a risk that the mask will come loose or lose its seal. For people that are claustrophobic, this type of therapy can make them feel closed in and like they're suffocating while they sleep. CPAP machines require continual maintenance due to the replacement of filters and other components. They also require daily cleaning to remove bacteria buildup in the system. This means extra cost to the user, and they are put at risk at a respiratory infection if the machine is not cleaned properly. Because of the many compliance issues with CPAP therapy, 42% of people refuse this therapy when it's offered to them, and 78% abandon the treatment within the first 6 months. There is another treatment option for obstructive sleep apnea, and this therapy is oral sleep appliance therapy. These appliances are custom fabricated to your teeth. Your dentist will take detailed digital scans or high-definition impressions of your teeth to ensure a proper fit and function of the appliance. An oral sleep appliance is much like a retainer or night guard. They are lightweight and comfortable to wear while you sleep. The appliance gently shifts the lower jaw forward and opens the lower airway while you sleep. In this picture, you can see an oral appliance in a person's mouth while they are sleeping. Notice how the appliance holds the jaw in a neutral to slightly forward position. This positioning of the jaw allows the airway to be completely open while a person is sleeping. Let us look at 2 ways that you can be tested to determine if you are at risk for obstructive sleep apnea. There are 2 types of diagnostic sleep testing methods available. There is a polysomnography, which is called a PSG, and there is also a home sleep test known as an HST. To have a polysomnograph, you need to go to a local sleep lab. This type of testing can determine if you have obstructive sleep apnea, but it is also designed to provide a level of sleep testing that you may not need. A polysomnograph requires a 1 or 2 night stay at a sleep lab or hospital. You must only sleep on your back, so this type of testing doesn't work well with people that sleep in other positions. The normal cost range for this type of testing is from $2,800 to $4,000. A much more convenient form of testing is a home sleep test. You can take this form of sleep testing in the comfort of your own home and bed. You can sleep in any position with this type of testing and requires less equipment and wiring on your body. The test is self-administered, allowing the patient to spend the night in their own bed at a lower cost. The cost of a home sleep test ranges between $200 to $300. This type of testing is specifically for diagnosing obstructive sleep apnea only and can be done at a much lower cost. This is the type of sleep testing that your dentist will recommend to you and can help you get scheduled for. We have presented you with some valuable information about obstructive sleep apnea. You may be wondering what the next thing is you should do if you suspect that you have obstructive sleep apnea. We want to encourage you to contact your dentist to be screened and to schedule a home sleep test. Your dentist is professionally trained and experienced in helping people with obstructive sleep apnea. Thank you for watching this presentation about obstructive sleep apnea. Please understand that obstructive sleep apnea is a serious, life-threatening disorder. If sleep testing determines that you have it, you should be treated as soon as possible. The good news is that your dentist can help you.